Good afternoon and welcome to Webinar Wednesday. Today we are joined by Heidi Horn, Nuvolo VP of Healthcare Industry Solutions, Dustin Smith, Nuvolo Executive Solution Consultant, and Olga Leskova-Benedicts, Nuvolo Product Manager. Webinar Wednesday would like to thank our sponsor Nuvolo. The Nuvolo Connected Workplace for Healthcare solution is the only modern CMMS built on ServiceNow, designed to meet the unique regulatory, clinical, operational, and cybersecurity needs of the healthcare industry. For more information, please visit nuvolo.com. Just a reminder that MD Expo is headed to Temecula's Valley's Pachanga Casino and Resort next week, October the 11th to the 13th. Registration is still open online at mdexposhow.com, and you can use your VIP code 22MDESOCAL at checkout to receive complimentary admission to this 3-day conference. The VIP code is available to individuals employed with a hospital, healthcare facility, or are active military or students. Today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll wrap up today's presentation with a live Q&A, so please submit your question anytime using the questions feature on the webinar dashboard. Okay, let's kick off today's webinar by giving away one of our brand new Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. October is National Pizza Month. Which country did pizza originate from? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. As I mentioned earlier, Heidi Horn, Dustin Smith, and Olga Leskova-Benedicts are our presenters today, and we'll be discussing the challenges of clinical equipment replacement planning, an objective and simple approach. Heidi, you may begin whenever you're ready.
Thank you, Linda, and welcome back. One of these days you will have to tell me where you're getting your trivia questions. I always chuckle when I hear them. But thank you everyone for attending. We are so happy to be here today and to talk to you about this. Just to give you a brief background about me. Again, my name is Heidi Horn. I am the VP of Industry Solutions at Nuvolo. And just so you know, I do know a little bit about what I'm talking about today. I do have over 20 years of experience in HCM. I ran a 120-person multi-state HCM department prior to joining Nuvolo in 2019. I still remain very active in the healthcare industry, working closely with HCM and facilities departments. I have been heavily involved with AMI for about 15 years. I'm an AMI fellow and currently serve as the finance committee chair of AMI's board of directors, as well as previous chair of AMI's Technology Management Council. Furthermore, I have submitted and evaluated more clinical equipment capital requests in my 20 years than I care to count. So this is a conversation I'm having today, which is very near and dear to my heart. Dustin?
Yeah, thanks, Heidi. So I definitely can't keep up with Heidi in regards to experience, but I'll sure as hell try. So I'm Dustin Smith.
You're not as old,
Dustin. That's fair. So I'm a certified healthcare technology manager, and I've been with Nuvolo a little over 2 years now. And it's similar to Heidi, I played a fairly critical role in our capital planning process in regards to our medical device replacement plans, and that was twofold. So I did that for a period as a budget analyst for Intermountain Healthcare, where I actually supported our clinical equipment services program, and then also our imaging equipment services program. And then later on in my career, I actually kind of was working with our clinicians to ultimately gather the information about their needs when I was the director of central support with healthcare technology management with Intermountain Healthcare. So I've been able to see kind of two different frames of reference in regards to capital planning, and I'm really excited about what Olga and team have kind of put together. And we're all very privileged to have Olga on the phone with us today to ultimately walk us through some of our process and some of the things that have been put into our capital planning module. So with that, I'll turn it over to Olga.
Thank you, Dustin, and thank you for making it even harder for me to follow that. But my name is Olga Liskova Benitez, and I'm the product manager for Nuvolo's capital planning and projects product. I've been with Nuvolo for about 1.5 years, and prior to joining Nuvolo, I worked primarily in public sector, supporting multiple U.S. federal agencies as an IT project manager and capital planning consultants. So I do also understand firsthand the struggle that the capital planners are facing on a daily basis. I appreciate you all joining us today and looking forward to sharing some exciting things about Nuvolo capital planning product. Back to you, Heidi.
Thanks. Okay, so we're going to talk a little bit first, just kick this off, about medical equipment replacement planning today. And some of these processes probably will look very familiar, and I'm sure some of them might be different, but we'll give you a kind of a general overview. So to start with, the main reasons for replacing medical equipment. And again, these are the main reasons, but they might not be all of the reasons, but they are the main reasons that we typically see. So first of all, you might have an end of support life resulting in a scarcity of economical parts. And economical, obviously, is one of the main phrases here. You might have parts available, but if they get too expensive, obviously that becomes challenging to continue to purchase them. Also, in addition to, or you might have a lack of experienced repair labor. This might be your in-house person that you had trained on a particular device left, or it might be because you're in a rural area and you have, it's harder for either the OEM or a third-party independent service organization to get to your site. Whatever the reason is, you are obviously having a hard time getting things repaired and there's too much downtime. Similarly, there might be a cost of your cost of repair for a particular device or a bunch of devices that are similar in model might be excessive, and that the word excessive is subjective. But what we see oftentimes is that either the cost of repair is nearing or exceeding the equipment's current value and or its replacement cost. And again, similar to like having a car, when you're putting too many parts into it, you're taking it to the shop too often, you start looking at replacing it. Age, reliability, and or safety of the equipment is in question is another reason. And again, these are all very similar, as you can see, but there's slight different variances here. And this includes your recalled equipment. So again, if your equipment is getting up there or your mean time between failure is becoming too frequent, or you know, because of the reliability of the equipment or whatever reason you're concerned about the safety, that's when you start looking at replacing it, obviously. Another reason that is very common is the equipment is clinically obsolete or it is viewed as such. And I put there in parentheses, basically the physicians want a new one. And this is something I think all of you can relate to a little bit. So when the equipment decides that the old equipment doesn't have something that they feel is valuable on and that is in the newer models. For example, it doesn't have the capabilities such as EMR integration, or it doesn't have a network capability or automated workflows, alarm management, the list goes on and on. For whatever reason, they decide that the newer model is has something that they want and the older model is obsolete. That is when we start looking at replacing equipment. And then finally, but not least, is equipment is networked and cannot be sufficiently protected from cyber threats. Again, we see this becoming more and more common, obviously. So you might have a device that has an unsupported operating system, or it's identified by your IT department as vulnerable for whatever reason, and it cannot be protected. It cannot be sufficiently protected through other means. Then oftentimes it's determined that you have to replace it as well. Okay. So you have all those different reasons for wanting to replace your equipment. So this is a process, again, I realize that many of you might have additional steps in here. Some of you might have fewer steps in how you do it. But from talking to people and looking at the different publications about you know, how you identify and prioritize medical equipment replacement, this is a general process of what we see today. And this is similar to what we did, quite frankly, when I was looking at replacing equipment. So you would download your medical equipment inventory into a spreadsheet, an Excel spreadsheet, along with hopefully its identifying information that would probably include your make, model, the description of the equipment, asset number, who owns it, Hopefully you have the age of the equipment. Also, hopefully you have the purchase cost. And then also you want to look at the maintenance history in the last 12 months, possibly 24 months. And I say that because I see a lot of people wanting to go back and look at the entire history of the equipment. And if you've had it for 10 years, they want to go all the way back and look at, you know, the entire history. And I would caution people to say it doesn't really matter what happened you know, after the last 24 months. I would even say 12 months is more appropriate because, again, the device might have been working fine for the first 8 years of its life, and the last 2 years, it's been a lemon. So you want to look at that last 12 months, 24 months max. And what you're looking at is your mean time between failure, your reliability, and the maintenance cost. And again, comparing that to the purchase cost as well as replacement cost. And then if you have it, hopefully, you might also want to look at the American Hospital Association expected useful life for that equipment type and other criteria your hospital deems important. So all of that gets downloaded and dumped into an Excel spreadsheet for all tens of thousands of devices you might have. You obviously have a huge list at this point in time. Then you have to filter that long list down using different criteria that you know, deem, whether it's like this is what our budget is, you know, it might be we're only allowing so much per department, whatever it is, you have to filter that list down so that at least it's somewhat workable. Then you go through the very lengthy process of manually identifying in the spreadsheet the reason for recommending replacement. And that could be things like the end, it's at end of life, things I mentioned on the previous slide, it's mandatory recall, it's now deemed unreliable, the cost of service is too high, all those reasons we talked about. So then we go into the prioritization process, and you want to manually prioritize that equipment. What we all know is that there's always much more equipment that you determine needs to be replaced than there is budget. And so because of that, you have to prioritize it based on the different criteria we've already talked about. And this one has to go is the most important. Then we get down here. And as you know, sometimes there's some politicking that's involved. Sometimes it's based on how much money, again, is in the capital budget. All of those things come into play. So obviously, there are a lot of challenges with this process, and have lived through all of them. And one of the biggest challenges is it's very time consuming. It took me weeks of going through this process, and it seemed like as soon as I got through it, something needed to be updated, whether it was a new request came in from a physician, or there was possibly a recall, or whatever reason. As soon as the weeks went by, then you found out the equipment, or that the list that you had produced was obsolete because of various changes. So it's not real time. The data becomes quickly outdated. The other issue is that it's also, often because you lack the data points, and then that's common. You don't have all the data points to make an objective decision, and so the decision-making process becomes subjective, and it's driven a lot of times by the loudest, I call it the squeaky wheel, the physician who has the ear of administration, or who's yelling the loudest, or the department head, or whatever the case might be. Oftentimes that will end up taking precedent because you lack an objective process. The other issue is it's difficult to weight different criteria using spreadsheets. So what I mean by this, by weighting it, is that you have the criticality of the equipment, or the reason for replacement. For example, if it was a mandatory recall that you have to replace the equipment, or it was the equipment has failed altogether. There's all sorts of different reasons, but that criticality has different weights, and trying to put all of that into a spreadsheet and come out with a meaningful report is extremely difficult, as those of you who've been through this understand. And again, that gets me to the next part, which is it's difficult to create these meaningful reports to present to capital decision makers. So you want the capital decision makers to understand what the priorities are, why they are priorities, and to see all the data that went into it, so that they understand that your recommendation is valid, essentially. And finally, not presenting objective data may lead to capital decision makers discounting it. And as you know, if you give them a list and say, here's my priority 1, 2, 3, 4, and 5. It doesn't have any supporting information along with it. They're not going to put a whole lot of credence to that. So unfortunately, that's what happened. So those are the challenges with this process. Now, fortunately, if you can go to the next slide, please, we've come up with a simpler approach that actually automates a lot of what we do. And Nuvolo is going to talk about capital planning application, which is an objective and simple approach that addresses these challenges. Olga?
Thank you, Heidi. I actually get to do the fun part. Today, I'm going to share with you our journey of building a world-class capital planning product. Next slide, please. So when developing Nuvolo's capital planning product that was released in January of this year, our team has followed the innovation approach called ODI, or outcome-driven innovation. It's a data-driven, customer-centric strategy and innovation process, which includes a thorough market research and user experience research and design. It is very simple yet powerful way of thinking that puts all the desired outcomes at the center of every conversation. So rather than focusing on existing processes or potential solution, it kind of peels those layers of subjectivity off to get to the core, which is what are the jobs that need to get done, or what are the outcomes that those doing the job on a daily basis are trying to achieve. So this process employs both qualitative and quantitative methods, and as part of our qualitative phase, we interviewed a number of HCM industry leaders whose input helped us define that core job to be done and help us build an exhaustive job map for our capital planners with all applicable steps. And Heidi mentioned some of them, from determining current inventory and collecting required data to producing an easy to digest and comprehensive multi-year capital plan. After completing the ODI research, we have started our journey of designing and building out a proof of concept. We did a couple of rounds of user testing and design iteration until we were able to reach the great level of certainty that the product that we were building would be life-changing to many of those who are struggling with the capital planning activities on a regular basis, and ultimately help them reach their outcomes, so help them get the job done. As a result, we were able to build the products that help solve many of those challenges that those responsible for capital planning within their organization are faced with on a regular basis. And we will continue to further enhance it based on the outcomes of our research. Next slide. Thank you. So among such challenges, and Heidi already covered most of these, but data availability, data integrity, as well as ability to objectively prioritize all capital needs and present them in a way that allows the leadership to make fast and informed budget decisions. All these questions came up a lot during our research interviews, and I'm sure that most of them resonate with you, but hopefully after the demo following my presentation, you will see how we address these challenges with our Nuvolo capital planning tools. Next slide. So our product as this exists today consists of two major capabilities. First one is the scoring and prioritization of capital needs. So we built a highly configurable scoring algorithm that pulls all the relevant data from your CMMS, such as the age, condition, end of life, end of service life, maintenance cost, reliability, and criticality of the asset, and it automatically prioritizes it based on the criteria that you determine best fits your organization. And these are the metrics that we use for our out-of-the-box HCM capital planning solution. However, the tool configurability allows you to add, remove, or modify any of these metrics. Second major capability is the custom dashboard, which allows our clients to quickly gain some valuable insights into the most important aspects of their capital plan. The dashboard consists of views which provide both a holistic picture of all budget years included, and therefore allows for that easy comparison year over year. And it also provides a detailed overview of a particular capital plan year. Next slide, please. So I want to talk a little bit today about the value that we strive to deliver to our clients. So the main goal of our Nuvolo capital planning product is to turn reactive and subjective decision-making into data-driven and evidence-based budget planning and forecasting. And among many benefits of this product is its configurability. We were able to build an easy-to-configure solution that's made to fit your organization's individual capital planning needs. Next, we provide our users with the right tools to easily identify, assess, and prioritize their capital needs and asset repair and replacement timing, again, based on the most relevant data that's already available in your CMMS. Additionally, through our interactive real-time dashboard, we provide a way for capital planners to quickly gain some actionable insights into the most important aspects of the capital plan. And last but not least, we help capital planners and the decision makers make more sense of the incredible amount of data that your organization generates on a daily basis through the advanced filtering capability that's also available on our capital planning dashboard. And as I alluded to earlier, we're continuing to further enhance our product with every release by adding even more features and capabilities to make the life of all capital planners out there just a bit easier. So I do want to talk a little bit about what's coming next. So one of the capabilities that was recently released is the data collection and survey tool, which provides capital planners with the ability to collect some of the crucial asset assessment data that's not currently captured in CMMS to leverage it in that final decision-making process. Again, going back to the data integrity and data availability pain point, capital planning process is already complicated as is, given the amount of data and other factors that go into it. So, and what makes it even more complicated is capital planners having to go and hunt for the right data and having to validate it. And as a result, as Heidi mentioned, it takes them weeks or even months to gather everything they need so that they can make those data-driven and evidence-based budget decisions. And what about other critical data that's not currently in the database, like asset department alignment with the strategic goals and objectives, or its revenue criticality? Our new data collection tool will be able to address all those pain points. Next, we have 3 new capabilities coming out really soon, which are our deficiency level scoring and prioritization, and it's highly thought after, mostly in the facilities world. Then we also have the capital request, which is a capability that will allow capital planners to include any brand new capital request into the planning exercise. Again, very important, since in order for capital planners and for capital decision makers to have a full picture of their upcoming capital budget needs, they really need to take into account both existing replacement repair needs as well as all of the brand new capital requests. And finally, we also have the budget request capability coming out soon. As most of you probably know, capital planning is part of the cyclical process that kind of serves as the main input into the budgeting process. So the budget request is just the next logical step that needs to be created in order to secure the funding for all that work that has been planned. So with this new capability, again, that's coming out shortly, capital planners or budget officers will be able to generate a budget request from a finalized capital plan that will then kind of kick off that budget planning cycle and eventually serve as a link between capital planning items and work projects or capital projects. And this is really where the integration with our projects product come into play, ability to create work projects with associated work orders directly from an approved budget line item. Then the next big thing for us will be the 360 integration with our maintenance product. Again, we're already leveraging all the asset data available in CMMS to kind of prioritize and assess all the capital needs. Now we need a way to feed that results of the capital planning exercise, plan replacement year specifically, back into CMMS, meaning if, for example, a decision was made to replace an asset, that might impact the maintenance plan for it or whatnot. So it is crucial for the data to be available to our technicians right on the asset record itself to help inform their next steps. And of course, down the road, we're looking to continue to further enhance our product and features based on the extensive user and market research. And that's all I got for today. And I will turn it over to Dustin. Thank you, everyone.
All right, thank you, Olga. So we've talked about what it is. Now let's kind of show it, and then we'll discuss some of the benefits as we go through this as well. So here's the information that we're already producing. We're already filling out our work orders. We understand our PM schedules. We're taking care of our corrective maintenance, our recalls. We've recorded appropriately what the device is, what the risk score is, and this is ultimately pushing into our financials. So we're doing the work, we're loading the back end. One of the things that came up several times during the PowerPoint is the data. We are leveraging that data, we're pushing it into the system. Now let's actually produce something in a meaningful way that's not only visually stimulating, but we can also share with others to easily provide that consultative approach to our capital planning process. So here is ultimately our outcome. Here's that beautiful visualization that we can start looking at not just annually, where a lot of times that's where our capital planning process has landed in the past is, as Heidi alluded to, taking weeks to try and build out data, then I can start to make a plan. Our goal in establishing our capital planning product is let's do this more frequently. Why can't we take that information that's being digested, start to hone in on a particular asset list, and ultimately see where a device lands in regards to our prioritization? So once we have all of this information readily available, we can start to pull in our specific devices, and then it's loading our prioritization score, and we can even calculate a prioritization year or a replacement year. If I wanted to actually modify this, I can do this directly from our capital planning tool, and it's going to let me know that I've changed my replacement year upon saving. So we now have the ability to go through and more frequently start some of this work. And then once we have an understanding of kind of, again, where we want to be consultative, I can then push this into a spreadsheet. I can download it. And I could actually pass that off to individuals. When I think back to my experience, really as a budget analyst or even as the director of central support, oftentimes I was looking at this from a site level, or because we had a mobile medical equipment team, and this was ultimately summed up as logistics, we had certain devices that were shared amongst all of our sites. And so being able to filter based on different criteria, this enables me to look at this through the lens of how I function. I mean, even right here, it looks like the vast majority of my assets are due in 2027, and that's because most of my devices are Hospiro pumps. So I can now look at this, and even as I'm starting to think about strategic initiatives revolving standardization or my own business processes, again, I can filter and create that criteria that enables me to better comprehend exactly what's in scope for a particular capital replacement plan. And again, I could then export this and push it to another group if needed. And then also, I think it's important to think that to realize oftentimes in HTM, we're again taking that consultative approach. And so being able to, again, go through and make that first stab and export this, if there's particular business stakeholders, for instance, I want to be able to send all of my mobile medical equipment fleet and my thought processes over to the director of logistics, I can now do that as soon as this is done downloading. And so they're able to understand my considerations that are built off of our equipment history, as Olga alluded to, that's been pushed into our CMMS by your technician's diligence already. And then after you take kind of your first step, you can adapt this as necessary. So again, this is kind of the pretty outcome. So let's talk about some of the nuts and bolts for just a moment, because as we think through our business processes and ensuring the appropriate information is populated, we want to know, A, how do I set this up? How do I understand that I'm putting in place the appropriate criteria for our capital plans? Well, when we set up a capital plan, we're able to define what's in and out. Here, I can define, I want really any of those devices that are installed or operational. That's my focal point. I don't want to be evaluating my retired assets. I don't want to be evaluating anything that's been decommissioned. In addition to this, what information must be required? And you're given the tools to be able to determine, again, what's in and out of your capital plan. One of the things to note is certain organizations may have a minor equipment budget, and maybe you don't want to evaluate any devices that are under $5,000. That's up to you. And so we give you the ability to, again, as Olga alluded to in terms of the product value, there's the ability to make it your own. And so this is one of the ways where we're making it ours. We've talked through simplifying the prioritization process in terms of being able to understand the algorithm, and that's one of the areas that we're going to go to next, is how do these prioritization rules get loaded? How is that information being pulled into the system? Here are the clinical scoring rules that come upon acquisition. What's important to realize is you can modify these. Your capital replacement plan and business process, there may be aspects of this that you're not concerned with, or you want a higher rating. A great example is some organizations, depending on what you're using as your useful life, Heidi alluded to the AHA guidelines, and that's most organizations are likely leveraging that. But if you're not, and if you're modifying your asset life, maybe you want to have these scores actually mean less. Maybe you have a more accurate representation of your asset life than the AHA guidelines. Then all of a sudden your useful life may be a little less important. Or even end of support life. I look back to my experience in the past, and I want to say we got end of support letters for the Neptune 2s about 6 months before they were totally done. And so we were having to we had to seek contingency funds immediately because it didn't fit within our capital planning period. So this, to me, again, going back to the idea of we're trying to make it so you can perform some of this work more often. That would have helped me out in terms of putting the justification before our finance team. And if I was leveraging a higher score for end of support life, then it would immediately rise to the top. Again, it's about taking the data, the work that your technicians have already performed, and putting it in a meaningful, digestible format that you can easily share with others. In addition to this, it's important to understand what data elements are missing. Do you have your acquisition costs loaded? Do you have your conditions loaded? Do we have an owning department? This gives you your ability to create essentially a hit list of devices that need to be handled. I know in my past, I leveraged something very similar when I was at Intermountain Healthcare. We had a 509 report, and it was simply because we wanted that one cost in place that we could always reference to know that we had to update the acquisition cost. So now, instead of having to find ways to cheat the system, which is really what our 509 report was, we've taken the time and truly been thoughtful about the way this was created so that you know how to get to your hit list. This is my 509 report. We also, when you're setting this up, you're able to delineate, again, ways to make it your own, how my priority ranges work, so how that algorithm is going to sort into our different groupings, our default budget per year, and then also the default capital plan configuration. Because again, going back to this, thinking about that capital plan configuration, there's really multiple ways to skin a cat here. I can manage my configurations to some extent through my filter. Okay, when I was talking about my mobile medical equipment replacement, I'm doing this simply by looking at my logistics department. And I know that's the way my organization has structured this. Alternatively, I could have leveraged my asset type and looked at very specific asset types to actually perform ultimately the exact same task. Okay, so here is what my logistics organization owns. So when I'm looking at my different filters, which I can then go through and subsequently save, I can do the same task through a capital plan configuration. So it really comes down to, who do I want to own this as far as a business process in managing Nuvolo, and how do I want to share this? So I think filters is oftentimes going to be probably the best approach. Olga, do you have any insight there or any comments?
I agree with you, Dustin. As a matter of fact, during our user testing, our advanced filtering capability was often called an engine behind the dashboard, and it truly is, right? It allows you to get to those granular levels and do the deep dive into the data. Again, the incredible amount of data that you usually process as part of the capital planning exercise.
Thank you. So really, I mean, this is a byproduct of our research and design process. We're listening to you. We're doing what we can to ensure that you have the tools to be successful. And as Olga alluded to earlier, we're not done listening. More will continue to come. As we're thinking about the introduction of the capital requests, there's certain things that are going to become more and more common. We're seeing organizations go through massive standardization efforts. There may be certain needs in regards to working with third parties, such as Atania in the future. Also, understanding within our scores, is this a standardized model? These are some of the things that we're going to continue to assess the market to try and better understand your needs, similar to the introduction of our surveys and being able to survey some of those capital stakeholders that ultimately have elements that we need to incorporate, whether qualitative or quantitative, into our capital planning process. So I hope that this has been a good demonstration of how Nuvolo can really provide you some additional value through our capital planning process by making it your own, simplifying the prioritization process through our algorithms that you can set, and leveraging all of the data that you've already put into the connected workplace. Let's make sure that the work that your technicians perform is leveraged to the best of our ability. And with that, we'll open it up for questions.
Yeah, and Dustin, before we move on too, I wanted to make sure everybody realized that you and I will be at MD Expo, and we'll be available to show this more in depth if anybody wants to, is going there and wants to meet with us. So please come join us. But for those of you who aren't able to attend, please put your Q&A or your questions into the question box.
Okay, thanks so much, guys. Yes, we've had a few questions in. So the first one actually is, what if my hospital has different criteria it wants to use in setting the equipment replacement priorities?
Yep, absolutely. So you can go through and you can add that to the prioritization rules, and then it's simply going to aggregate based on the number you've provided. So it was really the filtering criteria going into one of these. So it's understanding really the field you want to look at and then setting up your condition.
Yep, and just to add to that, sorry, Dustin, I think you've heard multiple times throughout the presentation about the configurability of the tool, right? So in addition to being able to modify some of the scoring rules, as Dustin showed before, you can also define the scope of your capital plan, right? So again, what he showed today is the out-of-the-box settings, right? But you can, again, if you, as Dustin alluded, if you want to add, for example, a specific threshold, or if you want to look only at the specific department or location, you can modify that scope and make it truly yours through the configuration plan.
And that's so important, Olga. I just want to kind of add to that. A lot of us, and I'm going to use myself as included, I did not realize how different each HTM department was from the other HTM departments until I took on this role at Nuvolo and actually had a firsthand, got to see how everybody does things a little bit differently. And so I know sometimes people will say, well, I just want you to tell me how it should be done. And what we realize is that everybody does it a little bit differently. This is driven by the way they interpret maybe Joint Commission or the way their hospital policies and procedures, whatever the case might be, or the fact that, obviously a large urban hospital is very different than a small rural standalone hospital. All those things come into changes. And so again, what the beauty of this is that it gives you the ability to implement those differences so that you can do it the way that makes the most sense for your organization.
Okay, another question that's come in is, do you need to have the Nuvolo CMMS to use the capital planning?
Yep, so that is a critical component. This is really built on the backbone of the connected workplace. So your HTM module is providing that context. So again, filling out those work orders and the work that your technicians are doing in Nuvolo today, or in the future, that's what's going to really enable the ability to leverage these algorithms and ultimately build out the prioritization and replacement years.
It's probably also important to note, though, it also can be used with the facilities maintenance product as well. So you have both HTM asset management as well as the facilities maintenance, and this is a add-on, if a product is, if you want to think of it that way.
Okay, so how do you get input from key stakeholders on priorities?
I can take this one. It actually also came up a lot during our research. Again, capital planning is a strategic exercise, so there are a lot of different factors, such as strategic goals and priorities, as Heidi mentioned in the beginning, revenue goals, regulatory risk, and other factors that need to be taken into account in addition to the current inventory of assets or its condition and performance. So this is where the data collection survey tool that Dustin mentioned kind of comes into play. So capital planners will have the ability to create custom surveys within the capital plan and then send them out to different stakeholders, whether it's the department owners or technicians who kind of deal with those assets on a daily basis, to collect some of that additional data, whether it's a missing data that was identified during the capital planning exercise, or it's some data that doesn't even exist, right, in CMMS. For example, Heidi was talking earlier about the cybersecurity risk that's becoming more critical right now. If there is, for example, if an IT system that a medical clinical equipment is tied to is approaching end of life, it's a huge potential risk that you need to be able to track. So to get all those additional data points, the capital planners will have the ability to leverage the survey capability to collect those additional data points that they can then later use in their decision-making process.
Okay. So what about net new equipment adds, and can those be included in the tool?
Yes, absolutely. So as part of the roadmap overview, I mentioned a capital request form feature that will be coming out shortly. Again, we understand that in order to kind of get that full picture of all of the organization capital needs, it's important to take account both the existing equipment as well as the brand new capital needs, right? So we are introducing a feature where anyone within the organization will be able to submit that capital request, then will go through the assessment and validation by the capital planning group and can then be included into the capital plan. Again, think about it as a business case, if you will, where a requester will need to provide some details, included justification, then those that capital planners can later on use to kind of assess and prioritize all the capital needs.
Okay, so if I wanted to add additional variables to the model, can the user do that him or herself?
Yes, so and Dustin can show, it's really simple. There are a couple of roles within the capital planning product, and someone with the admin rights will be able to go and set up and add new condition. And it's really simple. There's also a guided setup that comes complementary with the product that will guide those that are setting up the capital plan.
And just to illustrate this, this is not specifically on the device record. This is an example of information that we're able to pull about the device that's actually on the model record. So again, we're leveraging truly that hierarchy and the information that's loaded even at the asset type level. So it's really leveraging all of those capabilities built in within the connected workplace. So you put a lot of work into your Nuvolo deployment, and we're trying to really take advantage of all of that work. So I just wanted to showcase this really quick. because it illustrates that, again, configurability and the work that our team has put in towards making this easier and also leveraging your existing data and your data model.
Okay. Another question that's come is, how can we determine equipment expected lifespan?
Ooh, I mean, Heidi, I think this is something we could debate forever.
Yes, and we do, and there's, and so this gets down to, unfortunately, the lack of standardization in the HCM world. There are, I mentioned the American Hospital Association expected, I can't remember the exact word, expected life or life expectancy, expected useful life is what it's called. They do have a guide, and that is by equipment type. And I think Dustin also mentioned, you can also look at, if you have similar equipment and everything else, you can make a judgment call. But quite frankly, I have seen equipment, and I know all of you out there who are listening right now have seen the same thing, where they'll have a 5-year expected life expectancy, and somebody might have it, much longer than that, years after that, and it's still going strong. So it really, and all that is dependent on how well it's being maintained, quite frankly, maybe the conditions it's in, how much it's being used. All those things come into play. So it's unfortunate. It's hard to come up with one guide, that fits all. And so that's where we get into all these different criteria. The AHA expected useful life is one data point in this, and that should be evaluated. But you also need to look at, is it still going strong? Is it, not failing? Is it still clinically relevant, and the docs are still using it and liking it? All those things come into play. So I don't know, Dustin, if you have anything to add to that.
No, I think you nailed it. I mean, look towards standards, and that's really what the AHA guidelines are going to be. And then I would say you kind of adapt from there, and it's going to be organization specific. I hate to say that because we're not giving a clear, concise answer, but that's because it is ambiguous. It's something that I think to some extent you can go with AHA guidelines and leave it at that, and that's the closest you're going to get to kind of a finite example. But even within the AHA guidelines, what you'll quickly find is a lot of times it's not specific enough. And so to some extent, the biggest thing I would say is create a standard, create an internal policy, and let that guide you. And AHA guidelines is definitely a strong framework. It's an excellent place to start. But if you need that further delineation, have a method behind your madness.
Another question we've got here is, I see where COSR and MTVF can be set with different thresholds for inclusions. Does the model give you statistical analysts to give you insight on what to set the thresholds to?
Okay, and I mean this kind of goes into some next level functionality as well, being able to look at like standard deviations across a particular model. I would say it's something we're working towards. Olga, anything you want to add there?
So in terms of scoring, you can kind of define this threshold, right? Again, similar to how you would configure the scoring rules, you can define this thresholds. But the way the mean time between failure ratio is calculated, it's actually looking at the specific asset and compares it to all assets within the same asset type. And this is how that ratio is calculated. But again, it's entirely up to you to define the thresholds that are applicable to your organizations. And the same kind of goes for the cost of service ratio as well.
Okay, so another question here, is the supporting information done with an SBAR?
Oh, with an SBAR. So that's a great question. I think I would say an SBAR is likely going to be, you'd manage that outside of Nuvolo, but the information provided within a capital particular device, you could absolutely, thinking about logistics, right? So if we go back to our filter, we've got our logistics view. I could then take that entire asset list, and I'm going to have the prioritization score and my replacement year. I would think downloading this and including it with your SBAR would ultimately go a long way with your internal finance teams as far as being able to, again, justify these numbers with those scoring rules, and it gives you the data to better articulate the information in an SBAR. I think that's kind of what I would lean on. And this could be downloaded and then actually sent with likely your Word document for your SBAR.
Okay, we've got time for one more question. Is how well has this tool been adopted by facilities in Canada?
Facilities in Canada. This is a relatively new tool, and I think it's important to realize that. But again, going back to our research and design, we do believe it's a very, very firmly vetted tool and will do very good in the market. As far as Canadian facilities customers, I don't think we have one yet, but it's definitely one of those that we'd be excited to introduce this.
Okay, that's great. Well, we're coming up to our hour. We haven't got any more questions coming, so we can wrap up now. So thank you, Heidi, Dustin, and Olga, for your time today and for a great and informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide to our industry. So go ahead and visit nuvolo.com. As promised, the answer to today's trivia question is Italy. So congratulations to our winner, Scott Tarter. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so visit webinarwednesday.live for more details and complimentary registration. Thank you once again for your time today. Enjoy the rest of your day, and if you're going to Expo next week, have fun. So we'll sign off there. Thanks very much.
Thank you, everyone.
Thank you.
Bye.
Thank you.